Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hello, and welcome to this week's episode of the Baby Manual podcast. This is episode 11, Sleep. We're going to talk about baby sleep patterns, how to help your baby fall asleep and transfer them into their bed and stay asleep, how much crying is okay. We're going to talk about safe sleep and reducing the risk of sudden infant death syndrome or SIDS. We're going to talk about co-sleeping, division of nighttime work with a partner, some tips to help you sleep better, and a little bit about sleep training. All right, here we go. So baby sleep patterns. It's normal for newborns to sleep about 18 hours per 24-hour period, but they're doing it in 2 to 3 hour increments at a time, sometimes less and sometimes a tiny bit more. But you have to wake them up to feed them if they have slept for 4 hours. And you need to do this at least for the first 2 months of life or until your doctor says it's safe to let them sleep more than 4 hours. So newborns are pretty much only awake during the day to eat and then pee and poop and cry because they want to eat or because they just peed or pooped. So that's about the only time that they're awake for that first month or so. And then around a month of life is where they start to learn the difference between night and day. And so they start to have longer stretches of sleep at night, usually 4 hours at a time. And then they will still be waking up at least 1 to 3 times at night during that, around a month of age. But then they'll start to be a little bit more awake during the day. So you can help them learn the night-day difference a little sooner by interacting more during the day. So when it's light out, sing to your baby, talk to them, interact, play with them. And then at nighttime, when they wake up, it's just strictly business. You just take them into their changing table, you change their diaper, feed them, put them right back to bed. And if you do need to talk to them at that time, just do it in a very quiet, calm voice. Keep the lights dim and try to really convey the message that nighttime is for sleeping. Around 2 months of age, they start to be allowed to sleep more than 4 hours at a time, but double check with your doctor, make sure they're getting enough weight. And by 6 months of age, some babies can sleep through the night, but a lot of them are still waking at least 1 to 3 times. 6-month-old babies are typically taking 3 naps during the day and then sleeping a little bit better at night, but waking up a couple of times. Then by 9 months of age, they're down to 2 naps during the day. And at a year of age, they usually transition to 1 nap. And then somewhere around age 2 is where most children will drop that nap, but some will keep napping up until even age 5. It's normal for the first couple of years of life to wake up once or twice at night. So even up till they're 5 years old, your child might wake up at night. You'll see that it should get less and less frequent as they get older, but don't expect your baby to sleep through the night, at least for a while. It can be quite a while for some children. Some can sleep through the night sooner than that. So I know some babies that are sleeping through the night even as early as a few months of age. But again, all babies are different. Try not to compare your baby to your friend's babies because some just need more sleep than others and some wake up a little easier than others. I keep hearing about this 4 to 6 month sleep regression from my patients, and that's something we did not learn about in medical school or residency. It's not like a real medical thing. We do learn that around that age is when children start teething, and teething will make them sleep more poorly. So if you find your baby's waking up a lot at night, and also they seem a little cranky, maybe they're drooling, maybe they have a low-grade fever or some softer stools, because swallowing that extra saliva, if they're not drooling it out, they swallow it and that can cause some slippery poops, like some diarrhea. Those can all be signs that they're teething, and a little bit of Tylenol or ibuprofen can help them at night. So Tylenol is also called acetaminophen in the US or paracetamol outside of the US. And ibuprofen is an NSAID, and that one is okay once they're 6 months or older. You can do the ibuprofen. So I actually have learned through my training that babies start to sleep better at 4 to 6 months of age. And really, I think what that's about is just that their stomachs are larger. And so when they drink their full feed of breast milk or formula, it keeps them full a little bit longer. Some babies are starting to eat solid foods at this time, but starting solid foods will not make them sleep longer. It just is sort of a coincidental thing that happens at this age. But actually, solids, or when I say solids, I mean like purees or baby-led weaning, those actually have less calories per ounce than breast milk or formula most of the time. So it will actually make them get hungrier quicker, if anything. So we don't recommend giving any extra foods at this time. Rice cereal is not going to do anything for their sleep. It does not make them sleep any better. Really just, regular breast milk and formula up until 4 to 6 months of age. And if they're going through this sleep regression, talk to your doctor about it. It's probably teething related. So for total hours of sleep at different ages, newborns are sleeping about 18 hours per 24 scattered throughout the day. And then at 6 months old, they're sleeping about 14 to 18 hours. And that's 3 naps during the day and then 12 to 14 hours at night. And then at a year of age, they're sleeping about 12 to 14 hours per 24. And that's about 11 or 12 hours at night and 1 nap. That's about an hour or 2 during the day at that age. All right, so that's all for baby sleep patterns. Now, helping your baby fall asleep and stay asleep. So first, look for signs that your baby might be tired before they get too tired. Some of the early signs that baby is getting tired are their eyelids are drooping, they start rubbing their eyes, they might yawn, or they might start fussing a little bit. When you're getting your baby ready for bed, you should swaddle them for the first month or so of life. Once they're busting out of that swaddle pretty consistently, you can stop with that. You can go a little bit longer than a month if your baby loves it, but you have to stop swaddling when your baby starts rolling over, because that can be really dangerous if they roll over in a swaddle. I do like sleep sacks a lot, more so than a swaddling blanket, just because a swaddle blanket can get loose and potentially suffocate baby. But a sleep sack is something that usually zips or Velcros or somehow fastens closed in a safe way so that baby can't get out of it while they're sleeping. And it's kind of like a blanket that's attached to their body. So I like that because they don't get tangled in their sleep sacks. A good idea to get your baby ready for bed is to have a consistent wind down routine in the evening. So some common things that parents like to do in the evening are you have your last nighttime feed while you're holding baby and, rocking them, snuggling them, or you have their feed in their high chair once they're old enough to sit in a high chair. Then brush their teeth or brush their gums afterwards. You could do a bath. A lot of parents like the bath as a wind down because it does relax your baby and get them kind of ready for bed. And it's a clear signal, that it's part of the routine. But babies don't have to be washed every day. So really once or twice a week is usually fine for most babies and children. Once they get to be toddlers, they're kind of sticky all the time. They need to be washed most days, but really it's just when they're dirty, they need it. So bath is optional. Then maybe swaying with baby in your arms or rocking them in a rocking chair or a glider. And then speak to them in a quiet, soothing voice, tell them a story, read a book, sing a lullaby, that sort of thing. And ideally, we tell you to place your baby down awake but drowsy. And then they should fall asleep fully in their bed. Now, this is an ideal scenario. I know a lot of babies have a really hard time when you first set them down. They seem to wake up a little bit more. And some of them will cry because they want to be picked up again. Now, think about for newborns at the very least, they're used to being on the inside of a body that is constantly moving. There's constantly that sound of the heartbeat inside, and they're being held tightly on all sides by the uterus. So sort of recreating that environment will make them feel most comfortable. And so that's why the swaddling, it wraps them tightly, makes them feel really safe. Swaying with them, talking to them in a quiet voice. These kind of mimic what it was like on the inside. But then you set them down on that surface and the surface is still and it's stiff and they only really feel the support on one side. So that's why a lot of them will kind of wake up a bit. Now, this is something that all babies will get used to at some point. And if you're consistent with it and you're consistently putting them down onto the bed, they should get used to it and should be able to fall asleep. But we'll talk a little bit more about sleep training methods later on. And I don't actually like the name sleep training, but ways to help your baby fall asleep a little bit later on. So yeah, I know the awake but drowsy is an ideal scenario. I know it's really difficult to do, but just aim for that. It's okay if they fall on you a couple of times. It's just if they fall asleep on you all of the time, they're more likely to just get used to that and not want to sleep in the bed when they get older. So if your baby does fall asleep in your arms, I say put them down quickly. If you take your time when you're setting them down, if you do it really slowly, there's a lot of moments where they feel a transition and they could potentially wake up. So if you just really go from arms, set them down on the bed, within a few seconds. And then once you set them down, place a hand on top of them and for 10 or 20 seconds and feel their breathing, just kind of lightly rest your hand on them and they'll feel like they're still kind of protected. You can also very lightly rock them side to side with your hand. For babies that seem to want a little bit more, you can sit in a chair near the crib and talk to them in a soothing voice or sing to them. And then maybe the next night, move that chair farther away and eventually be able to just walk away after setting them down. You can also try things like blackout blinds or a white noise machine to help them settle in. But, again, those are mimicking that uterine environment, but also babies, I find that are used to this. If they don't really need it, they get used to it. And then it can be hard later for them to sleep because then they really need it to be totally dark and quiet. So they seem to be lighter sleepers. But if your baby's already a lighter sleeper, then it's something that can help. For teething infants, you can give Tylenol or ibuprofen at bedtime, and that can help them sleep a little bit better. And as I said earlier, one thing that does not work is rice cereal in the bottle. You really should not ever put rice cereal in the bottle, except if you're treating reflux and only with the guidance of your doctor, and only 1 teaspoon per 2 ounces for reflux. So you're never putting like full cereal in the bottle. That's really bad for your babies. And as I said earlier, that can actually make them sleep worse because it has less calories per ounce. Do not use melatonin in babies that are less than a year old. It's not safe for them. And then for older children, I wouldn't recommend using it more than 2 nights in a row because melatonin is something that your body produces naturally. And when you take a pill of melatonin, it's signaling your body that you don't have to produce as much. And so then the next night you won't produce as much. And so if you're using this for a few nights in a row, your body will not produce as much melatonin, and then you become dependent on it to fall asleep. And moreover, you start needing higher and higher doses. So melatonin is not a great thing as a chronic medication, but it is really good for a once in a while thing. For example, if you're traveling and your baby is jet lagged, that can be a great time to use it. And when I say baby, I mean your child, over a year. Don't give your child any sleeping medicines or any sedating antihistamines. Also, those are not safe in children. They actually will make them not breathe as deeply while they're sleeping and could make them stop breathing while they are sleeping. So I don't recommend any sleep medicines for children at all. All right, a little bit about crying. So most babies will cry a little bit when you first set them down, and it's okay to give them a couple of minutes to try to soothe themselves. Somewhere around 6 months of age, babies are starting to self-soothe. So you can let them cry or fuss a little bit. I'd say, less than 20 minutes of crying, ideally less than 5 minutes if you can. But as a parent, just whatever you're able to tolerate. If you feel like it's just too hard for you to listen to your baby cry, it is absolutely okay to pick them up and soothe them. And also, it is absolutely okay to let them try to soothe themselves too. So you can give them a chance to self-soothe, but if you feel like they're escalating or they're getting worse or, you just have given up, it's not working, then please pick them up. Crying it out is different. Letting a baby cry it out is just letting them cry until they fall asleep. And that is not recommended. That does cause psychological damage to babies. So, letting them cry for a few minutes is fine and will not harm them, but letting them cry until they fall asleep kind of gives them the signal that they've been abandoned. And that is not recommended for young babies. Also, if your baby ever gets to the point where they're gasping or they're holding their breath with crying and fainting, or if they're vomiting, those are signs that your baby has cried way too long. So next time, please don't let them cry that long. All right, safe sleep and reducing the risk of SIDS or sudden infant death syndrome. So the ABCs of safe sleep are alone, on their back, in a crib. So alone meaning no toys, no blankets, no other children or people in the bed with them, no bumpers, no loose sheets, no netting, nothing that goes around the crib that doesn't come with it. So it really is just, alone on a fitted sheet on the baby safe mattress that is in there. The B is for back, so on their back, in other words, face up. And C is for crib, and a crib could also be a bassinet or another safe sleep surface. So safe surfaces are firm, they have tight fitting sheets, and the baby's not able to roll out of it or fall out of it. So it could be potentially a box on the floor, it could be a crib, it could be a bassinet, and there are some things called co-sleepers that are actually really bassinets that are firm on 3 sides, and those are safe too. The ones that are soft, the soft baby nesty things that look kind of like pillows, that have pillows around the edges, are not considered safe for sleep. For safe sleep, pacifiers can actually reduce the risk of SIDS. We don't really know why that is. We think it kind of keeps baby a little bit more awake and alert, but we just know that it works. And so I am a fan of pacifiers. It's never too early to start a pacifier. I don't believe in nipple confusion, and I talk about that more in my episode on feeding. So that's about 2 or 3 episodes back if you want to check that out. I'm pro-pacifier for young babies, and you can stop it at a year of age or whenever, before their teeth come in, before their adult teeth come in. So you have plenty of time to get rid of that pacifier later. Smoking is a big risk factor for SIDS. So smoking outside can help, and then washing your hands and changing your clothes before coming around baby will help. Stopping smoking, of course, will reduce the risk the most. And then around 4 to 6 months, when baby starts rolling, it's especially important to stop swaddling, to not have any blankets or anything in the crib at that age. And the 4 to 6 month age, they start to kind of trick you. You're really used to setting your baby down and seeing them in exactly the same position when you go back to check on them. And once they start rolling, they could have their first rollover in their sleep and could potentially get tangled in something. I actually had a patient who passed away because of that. So it was the first time that baby had rolled over, and the parents were not expecting it at all. It was devastating. So please, remember, when they're getting close to rolling, there's nothing in that crib other than the baby and maybe a pacifier. Once they are rolling themselves over, you don't have to go back and flip them though. So, provided they're in that safe environment with just that tight fitted sheet on the mattress, they can roll themselves over and they can move their head around enough to safely position their own airway. So once they start flipping themselves over in their bed, you don't need to go back and check on them and flip them back. You can just let them sleep like that. But again, make sure nothing is in that crib with them. You should keep the crib or bassinet in the parent's room until 1 year of age is what's currently recommended, according to the Academy of Pediatrics. And then at 1 year of age, they should be transitioned into their own room in a crib. And then you can move them into a toddler bed around age 2 or 3. My best advice for that is when you're okay with them getting out of bed in the middle of the night, then you can transition them to that toddler bed. If you need them to stay in their bed the whole night, you can keep them in their crib as long as possible. Once they start climbing out of the crib, if they're escaping from it at night, then you need to transition to a toddler bed because it's not safe anymore for them to be in that crib. All right, a little bit about co-sleeping. Now, co-sleeping is officially considered unsafe by the American Academy of Pediatrics for the first year of life. After a year of life, a baby's allowed to sleep in a bed that has a blanket, and then at age 2 years of life, they can sleep in a bed that has pillows. So it's officially safe to co-sleep in your bed at age 2 years of life of your baby. But many parents will co-sleep at some point. And a lot of times it's when your baby gets sick for the first time. And that's actually potentially the most dangerous time to be sleeping with them. If you are going to be co-sleeping with your baby, to optimize safety, you can have a firm mattress with a tight fitted sheet on the floor in your room. And that would essentially mimic what would be a safe fitting sleeping surface for your baby, just one that also has a person on it with them. Now, again, it is considered unsafe to be co-sleeping with them because there is the potential that you could roll onto them. We had a baby in residency who passed away because the mom woke up and her arm was over the baby's face and the baby was not able to breathe. So, it does happen. It is dangerous, but if you are going to be doing it, this is the way to optimize it. No blankets, no pillows, just a firm mattress on the floor with the fitted sheet that's on it, attached to it, and nothing else on top of it. There are these devices that are called co-sleepers on the market, and some are safe and some are not. So the ones that are safe are the ones that have hard sides on either 3 or 4 sides, so they stick up and they have a hard flat surface on the bottom of them, nothing soft in them. So the ones that are the dangerous ones are the ones that look like pillows all around and have a bottom that's just made out of fabric and kind of cushions down. Those are not safe for sleeping in. So the ones that are safe are better called bassinets, really, but sometimes they are called co-sleepers. Just double check with your pediatrician if you're not sure whether one is safe. Also, the bottom of it needs to be completely flat. Anything inclined more than 10 degrees is considered dangerous. So it's not safe for your baby to sleep in a chair. They can sleep in a car seat or a baby swing for very short periods of time while they're being watched, but those are not places for them to be sleeping for a whole nap or for bedtime. Also, it's not safe to be sleeping in a chair holding your baby for you to fall asleep with baby asleep either on your chest or stomach or next to you in the bed. So if you're holding your baby and you're feeling tired, please go put them down in a safe sleep surface, and then you can go get some rest yourself. A couple of tips to help you sleep a little bit better at night If you have a partner, you can split the night between you. And there's a couple of different ways to do this. So one way is to split each night halfway. So maybe take a shift from one parent has a shift from 10 to 2 and the other one from 2 to 6. Remember that newborns, at least for the first few weeks of life, are going to be more awake during that 2 to 6 a.m. period, because that's when the prolactin level is the highest. And so that's when they want to eat the most often. It's mom's prolactin level is the highest at that time. So whether they're having bottles or not, it seems like babies want to be awake during those wee morning hours. If you're a breastfeeding mom and your partner wants to be giving bottles at night so you can get more rest, you can pump at the same time that your baby is feeding. And then maybe the partner could take those bottles, put them in the fridge and, label them. And then you can get back to sleep if it's their half of the night. Another way to do it is to alternate nights. So, one parent does one night, the other parent does the other night. And that's a good option if you are both working part-time or you're able to afford a night of missed sleep here and there, and then you get a good night of sleep. If you guys are splitting the night in some way, I do recommend having one parent stay in the room with the baby, or take the baby out into the living room or somewhere, another room that the sleeping parent is not in, so that they can really get their rest during that time. Another way to do it is to split the nighttime duties. So maybe one parent feeds the baby and one parent changes the diapers and puts them back to bed is another way to do it. I don't recommend this one as often, just because that means that both parents are awake throughout the night and both are being woken up every 2 to 3 hours. And sleep deprivation is a big deal, you guys. It's something that is really hard on new parents. It's something that's really hard to train for. Like, nobody's used to this. It's not natural to wake up every 2 or 3 hours throughout the night. You really do need sleep to recover. So do whatever you can to try to protect the sleep that you do get. And also remember that your partner's also exhausted and they need their sleep too. And I also know that sleeping when the baby sleeps is not an option. I was ready to strangle anyone that suggested that, because I had a baby that did not do naps during the day. So it's hard. Another way to potentially get a nap yourself, if you have a baby like that, is to ask a friend or a family member to watch the baby for a few hours, or maybe go out on a walk with them so that you can really just get a little nap in during the day. And don't use that time to catch up on housework. Like, really get your sleep. You need your sleep more than you need to tidy up your house right now. That can come later. Another way to help you sleep a little better is to minimize screen time. And staying off of devices. You know that things like TVs and phones and computers, they emit a wavelength of blue light that kind of tricks your brain into thinking it's the middle of the day. So it makes it a little harder to wind down and fall asleep. And when you do fall asleep, it makes it take a little bit longer to get that full, restful REM sleep in. So if you can, pick an ideal bedtime sometime early evening, like when your baby's last feed is, and then for 2 hours before that, try not to use any screens. If you have a wind down routine for yourself, sometimes that can really help to get ready for bed and help you get in a relaxed mode. So things like maybe take a shower or bath or wash your face, brush teeth, and then have like a relaxing activity like stretching, meditating, prayer, reading, something like that that's nice and quiet. That can help you really feel calm before you lie down to sleep. Because having a baby that, is crying at all random times throughout the day, it can really get you kind of anxious and amped up. And so it's nice to have that sort of settling down routine to calm your body. If you can, keep your bedroom dark and quiet. You can consider blackout blinds for yourself and a white noise machine. If baby's crying, you will almost definitely hear it if baby's in another room, but baby monitors are great for that. And the white noise machine really can help with just little sounds that they make at night, like when they're shuffling around or just cooing or things like that. So, it's up to you. If, that would help you sleep a little bit better, it could be worth it. Try to avoid caffeine and alcohol during the day. We all know that, caffeine wakes you up, alcohol makes you fall asleep, but both of them cause poorer quality sleep at night. So if at all possible, try to just drink loads of water. If you just drink a big glass of water in the morning, that can actually give you lots of energy that you might not need that caffeine, hopefully. Of course, do what you need to stay healthy, but and to stay awake and alert and able to play with your baby. If you really need that coffee, it is okay to have coffee while you're breastfeeding. Can cause a little bit more gas in the babies and just make it harder for you to sleep. Those are the two main drawbacks. If you have healthy power snacks at night, if you're breastfeeding, that can really help. Things that are processed tend to be higher carb, fat, and salt, and they'll kind of wake you up a little bit more. They're quick energy. But higher quality snacks, things like nuts or cheese, high protein snacks, plain yogurt, cottage cheese is good, even fruit and vegetables if you can. Those are great in the middle of the night to help you feel like you have enough energy to get through the breastfeed, feel replenished, but then also still be able to fall back asleep. And don't overeat as well, because having a really full stomach or too heavy of food can actually also keep you up longer. So just a small snack if you can at nighttime, and some water with that is great. If you have a lighter meal in the evening, that can also help you to sleep a little bit better at night versus having a big heavy meal. If you're worried about sleeping through something important and you're having a hard time winding down, I would just remind yourself, if baby is fed, they've been changed, they're happy and comfortable in their bed, they will wake you up if they need something. So it is okay for you to wind down and relax when you can. A lot of babies and moms are on the same sleep cycle. It's really fascinating. The studies have shown that dads are not in sync with their babies when it comes to sleep. So you might notice at night that moms tend to wake up the same time that baby wakes up. You might wake up and just notice your baby's moving around. And that's just because you're at the same point in sleep, pretty much. You're due to wake up around the same time. Breastfeeding moms, you have melatonin actually in your breast milk that's getting released. And that little bit too is helping to signal baby to stay, on the same cycle as you. So it's interesting. And don't get mad at your partner, please, for not waking up when the baby wakes up, because really it's breastfeeding moms are very most in sync with their babies, and all moms are in sync a little more than dads. It's sort of interesting how that works. But yeah, a baby's cry is the very best alarm clock. You can also, if you're worried about missing a feed, set a 4-hour timer. Every time after you feed, when you start feeding your baby, set that 4-hour timer, then it's okay to fall asleep, because that timer will go off when it's time for baby to eat again, in case they are oversleeping. Try to avoid sedating medications when you have a new baby, things like sleep aids, melatonin for yourself, sleep medicines. Those are unfortunately not ideal. They will decrease your quality of sleep, and they will make you want to sleep more, and they'll make it harder to wake up when your baby needs you. So please, at least for now, try not to take any medicines that help you to fall asleep. And then try to go to bed after your baby's nighttime feed. So I had mentioned the ideal bedtime earlier. If you're trying to get to bed somewhere around, 8 to 10 p.m., I would say, whenever your baby finishes that feed in there, lie down. If you wait for the next feed and you're going to bed like 11 or 12, that's another 2 or 3 hours that you could potentially have been sleeping. So, and that can make a huge difference overall in your sleep deficit. So go to bed after that baby's first evening feed. Don't try to stay up and do one more thing before bed. It's okay. Just let it go and try to go to bed early. As far as sleep training methods, there are a couple of different ones, and most of them are not recommended. So I'm just going to go through the more popular ones that I've heard of. And keep in mind, every baby is different. And if there was one thing that worked, there would be one sleep book, and it would work for every baby. And unfortunately, that's not the case. Some babies need more sleep than others. Some need more help to fall asleep than others. Some wake up easier than others. And that's just how it is. So here are some of the sleep methods we've heard of. The first one I'm going to talk about is cry it out, or the extinction method. This is where you just leave them until they fall asleep. You let them cry until they wear themselves out and they fall asleep. And this is not recommended because it makes babies feel neglected, and they get really stressed out. They have higher levels of stress hormones. They're more likely to get sick. It's bad for them. The baby wise method is also not recommended. Baby wise is where you're scheduling everything. You're scheduling their feeding, their playing, and their sleeping. This has been associated with serious problems. In the Baby Wise book, they suggest letting babies sleep through the night super early on and leaving them and letting them cry at night, which is actually not a good idea. And there are babies that have ended up in the hospital because of this method, with dehydration, poor weight gain, failure to thrive. They can even cause developmental delays and can make your breast milk dry up sooner than you wanted to. So Baby Wise is not recommended, unfortunately. Dr. Sears, I love Dr. Sears. The only problem with the Dr. Sears method is that he promotes co-sleeping, and he does promote following the baby's cues, so that's nice, but co-sleeping is not recommended. Dr. Spock also recommends following the baby cues, but he suggested placing them face down or on their side, and that's associated with SIDS, and so that is not recommended. So following baby's cues is a good idea, though. The Ferber method is another popular one. With Ferber, you have a wind down routine, and then you place them in their bed, awake but drowsy, and you leave them, and then you come back after a few minutes, and then you leave again and come back after a few minutes, and you have progressively longer time intervals that you're leaving them. So for the first night, you're leaving them, for example, for 5 minutes at a time, then maybe the next night for 7 minutes, maybe the next night for 10 minutes at a time, and coming back, after that predetermined amount of time and checking on them. And when you check on them, you don't pick them up, but you can talk to them to verbally soothe them. And then you walk back out of the room again, and you come back after that certain number of minutes, and you do that until they're asleep. So yeah, this is a very scientific method. And I mean, sleep is not a very exact science. So I love the idea of this, but I find that it just doesn't seem to work super well. You can totally try it though. It's just, there's nothing in this method that really makes sense. It's almost like operant conditioning, but it's not quite. So it may or may not help. Happiest Baby on the Block is a nice one. They have the 5 S's, but again, some of these are not safe. So the 5 S's are swaddling, side or stomach position, that one's unsafe, shushing, swinging, and sucking. And so swaddling is only recommended for that first month of life. And then after that, it's not. It is okay to do a sleep sack or a sleep suit at that time. And then the side and stomach position is also not recommended because babies can fall from that position onto their face and suffocate and could potentially die in their sleep. So they need to be placed only on their back every time. But shushing is great. That's that, noise that sounds like the inside of your body. So that'll kind of mimic that and make them feel soothed. Swinging, really, that means like gentle swaying and, rocking with them in a chair. And that's great. And sucking on a pacifier. Sucking on a pacifier is soothing to babies. And so again, I am pro-pacifier that can help them relax. So just a couple of closing remarks here. This is one of the hardest things. Sleep is one of the very hardest things that you will deal with as a parent. And trying to optimize your baby's sleep so that you can also get more sleep is so hard. So I really hope there are some tips in here that will help you. If you try a bunch of different things, it can be really confusing to your baby. So if you're switching different methods, if you're like, okay, we're going to try this thing, we're going to try Cry It Out, then we're going to try Ferber, then we're going to try Happiest Baby, your baby will get confused. So the very best thing is to have a consistent wind down routine at night, and then ideally try to place them in their bed when they're still awake, put that hand on them to keep them soothed, and try to allow them to fall asleep like that. The first few weeks are going to be the hardest. So when your baby is a few weeks old, you're going to start to feel better, but it's not until they're a few months old that you really start to feel like a human being again. Like you just feel like a zombie all day because of this lack of sleep. So it does get better. It will get better. Everyone eventually will sleep through the night. We'll be able to sleep through the night, right? I'm sure you guys were able to sleep through the night before kids. So, but just keep in mind, it'll probably happen around preschool age, if not before. And ideally, almost always before elementary school, they stop waking up at night and are able to sleep through. Of course, a nightmare is always normal here and there, but I mean like generally sleeping through most nights. Try not to compare your baby to anyone else's babies, okay? Your baby's twin is not the same person even. So, siblings, cousins, friends' babies, even yourself when you were a baby, there's so much variation in sleep and what is normal. And there are so many books out there to help your baby sleep because basically everything works and nothing works. It's every baby's different. So if there was, one thing that worked, that would be the book. I would write that book if I could. So yeah, sleep is very cultural. Remember that you're going to get a lot of opinions from family and friends. And so please try to stick to the safe sleeping practices. I know some of them don't feel natural. It doesn't feel natural to leave your baby in a bed when they're crying. It doesn't feel natural to set them down and have them cry and wake up a little bit. And it's something that they will eventually get used to. And I'm sorry, it's so hard. It does get better. Remember that optimizing your own sleep is going to help you feel better. It's going to keep you healthier. And it's going to allow you to be the best version of a parent for your baby. So please also protect your own sleep. I hope you found this helpful. If you want to pick up a copy of my book, The Baby Manual, I do have a chapter all about sleep with all of this advice in there as well. So you can have it all in one place that you can easily reference. I hope you join us next week. We're going to be talking about illnesses and red flags in babies. That's an important one. Take care. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.